So good morning. This is the second of two reviews for our first exam, which is next week. Does everybody have their study guides with them? Okay, that would be a good place to take notes. Does anybody have any questions before we get started? Okay, I'm going to share my screen. Okay, so everybody got the study guide, correct? Okay, a couple of things to remember. I've sent you some resources in the last couple of weeks. I've sent you some resources about test taking strategies that I've got from Elsevier. I've also sent you some math resources in your announcements. So if you struggle with either of those, I would suggest reviewing those. Okay. Information, the study guide was built around a few things. Okay. The study guide is a combination of your reading, okay, your notes, your first 3 weeks of notes, and our class lecture. Okay. So all the information should be continuous. Everything builds, each of those build on the other to finally come to a study guide. Okay, so you are responsible, even though we didn't cover all the readings, you're responsible for the content in there. I can't cover everything. Okay, so first and foremost, I gave you a summary of all the reading for week 1, 2, and 3 right in the front of your study guide. So if you need a quick reference of where you need to go back and review areas, it's all right here. Just want to double check to make sure you guys understand that under your reading assignments, when it says see Canvas course and it has bullets, okay, week 2, see Canvas course, where are you finding that information? I'm just asking you guys to make sure you know.
In the modules.
Thank you. Yep, right in the modules. Yep, yep. And then week 3, you didn't have any book reading. It was all in the module. Okay, and I covered that in class this week. Okay, so trying to make it more organized for you guys, so you're not running to all these different places looking to see what you need to review. So that's what you're responsible for. Okay, and then this 50 questions, multiple choice, select all that apply, some math problems. Again, review the math handouts and practice questions I sent you, all in your resources. Remember, always be thinking safety first, your ABCs, priority questions, right? What are some words that would jump out at you as a priority question? What is the greatest? What is the least? What is the most? Right? What is the first? What is the last? And then what about those negative questions in which it would say, we're trying to teach a parent about asthma. What would be the following answer that indicates they need more education? So it's kind of a negative frame. It's not what's the right answer, but what are they saying that needs more education? Does that make sense? So you have to really read the questions. I always suggest to read the question, read it once. There's a really good resource. It's test taking about, how do you eliminate wrong answers right off the top? But go back and read through those because they're really good resources. And I send them out every term and I always get positive feedback about them. Okay. So priority questions, read a question a second time. Maybe you missed that one word. Okay. And then prevention levels are primary, secondary, tertiary, related to each chapter. We talked about this in week 1. You have to be able to take your prevention levels and apply them to different topics we're covering. Okay, so you should be able to identify a primary, secondary, tertiary intervention with, say, the homeless or a migrant farmer, or what might a school nurse use, of the different topics we've covered over the last 3 weeks. Okay, this is definitely, I mean, I try and get as much in here as I can, but it's definitely not an all-inclusive study guide. You still have to review your notes, and you still have to review your reading. And even in this study guide, I've already highlighted some things that I was reviewing with the group yesterday. Just because I highlight the first sentence of a paragraph doesn't mean you don't have to read through the rest of the paragraph. Okay, so best practice, what are some helpful hints? Best practice to prepare for the exam is to review your notes, review weekly recordings, okay, review readings and discussions. Think about your 2 discussion posts, your first 2 weeks. They had to do with vulnerable populations, and then your childhood ailments, common childhood ailments. And common childhood ailments are addressed on the exam. Okay, so you can't just go to your notes that we covered. You know, your notes are a summary. Your notes are a summary of all the readings. Okay, and then your study guide is a summary of your readings and your notes and lecture. Okay, if you missed weeks 1 or 2 and haven't watched the recording, 1, 2, or 3, and haven't watched the recording, I would suggest you do watch the recording. If you miss parts of the lecture for whatever reason, even if it was 10 minutes, 20 minutes, probably good to go back and review that section of the recording. Okay. And then best practice, also attending unit exam review, which you're doing today. So it's great. Right. And then after that, I told the group yesterday, Dr. Kershaw, I don't know if I have any Dr. Kershaw students in here, but she's gone for the next 10 or 11 days. So I'm covering her classes. And so as far as tutoring, I'm all for tutoring, one-on-one. However, I need for you to do your part on the front end. Okay, so after you've done all of this, okay, you've gone through your study guide, you've gone through your notes, readings, you know, lectures. If there's still topics that you're not understanding, please reach out to me and we can do some tutoring over Zoom. Okay, but I don't use tutoring to reteach the material that you missed if you missed class or missed part of the lecture. I'd like for you to come prepared, knowing what you still need help with. Okay, is that fair?
Yeah.
Okay. Let's see. So let's review the study guide. Like I tell my other classes, the study guide is the final document of pulling everything together. So if you have a good understanding of the study guide, you will do fine on the exam. Okay. All right. So I'm not going to go through this line by line. We're going to go through the topics. Stop me. Has anybody reviewed this? And does anybody stop me as we go along? If you have any questions, if you've taken the time to review the study guide and you've marked a place where I don't understand this, jump in. Okay. This is the time to get clarification. This review is for you guys. Okay. Anybody have any questions before we go through this? So, without reading this, you guys, what's the difference between community-oriented and community-based nursing? And I want this to be interactive, right? This is for you. What's the difference between oriented and based?
I think
Did you say
you're already working in the community, like you're
Mhm.
already doing something, and then the oriented is when you're trying to build something.
Right? Right? That's a start. That's good. Community oriented is you're looking at the whole population. You're trying to orient yourself to the whole population. Okay? So you're primarily focused on, say, health promotion for the community rather than illness. Okay, you're looking at a whole group. We're community-based, you're right. You're in the community. You're working in the community. So you could be a school nurse, a hospice nurse, a home health nurse. Remember one of the quiz questions? Was that
It
one of the
was
quiz?
about doing like taking reviews based on like the community, like the vaccines that was community oriented, not based.
Right,
It
because
was
you were
about the community, but you weren't inside it at that time
correct.
doing care.
And the correct answer was the school nurse who is teaching teacher
Hmm.
and student how to use an inhaler. Right. She
Yes.
was based in the community doing her community nurse job. So that was focused on an individual. Okay, so that's the difference. Oriented is the big picture. You're looking at the whole population. You're looking at what does the community need. All right, we're based, you're taking care of individuals or families in the community.
So I guess
Okay,
community based is like your base is that community, your home base.
right, right. You're taking care of people in the community that need teaching or have issues. It's illness care. Okay, so we need to have an understanding of that. Okay, there's a nice little box here about primary, secondary, tertiary. You have to have a handle on this. Okay, there's questions on the exam that primary, secondary, tertiary. All right, so primary is prevention, right? Prevention of a problem before it ever occurs. So it could be, doesn't necessarily be prevention of diabetes, prevention of cardiovascular. We also have to think prevention for injuries, right? Helmet, seatbelts, immunizations, right? Secondary screening, right? Secondary is early identification for early intervention, right? So you're trying to screen for risk, right? So early detection, if you can catch it, may prevent the disease from advancing, right? You're trying to prevent complications, attempt to reverse the course, actually, right? That's why you have mammograms or blood pressure screenings or pap smears. It's all about trying to early identify any issues. And then tertiary treatment, right? You're trying to manage whatever is going on, whether it's a disease, a condition. You're trying to reduce the symptoms and improve the quality of life. Okay, so maybe a low sodium diet, checking blood glucose in a diabetic, weight loss for somebody with hypertension or obesity. Okay, so now's the time to ask for clarification if you need it. Does everybody understand this? And you have to be able to, like I said, apply these different levels of intervention to the different topics we're covering. And same with ADPI. I would say the same thing. What's ADPI? It's our nursing process, right? So you have to be able to take, an assessment of a pediatric patient to the hospital during your clinical, right? In your peds class is different from doing a home visit in your community to doing a pediatric assessment in the home, right? Much different looking ADPI. I mean, the ADPI is still the same. The nursing process is the same, but the way you're using the nursing process in the community setting is different. The A and the D and the P and the I and the E are all the same, but it just looks different on how you carry it out. Make sense? Okay. What did we learn about the uninsured and the underinsured? They generally receive less preventative care. Why is that?
Can't afford it.
Can't afford it, maybe access.
Maybe they live too far away from healthcare places, like people who live in rural settings.
And therefore, by the time they are evaluated, they are likely more in the advanced stages of whatever's going on, right? And then vulnerable populations. This is, for purposes of this class, this is, and there's many more vulnerable populations, I get it, but this is who we identify. Okay, remember that select all the apply question in quiz 1? Okay, the one group that gets skipped over a lot of times is the veterans. Okay, so please remember that veterans are part of a vulnerable population. Poor, homeless, don't get tripped up with pregnant people. It's pregnant teens, right? Because not all pregnant women are high risk, considered vulnerable, but pregnant teens are. Okay, migrant workers, mentally ill, substance abusers, chronic STDs, okay, complex physical disabilities. Okay, and then it goes through this is important. I didn't highlight it, but have a look at this. It talks about what vulnerable populations experience. Cumulative risks. Okay, what's disenfranchisement? When you feel disenfranchised, right?
It's like feeling detached
Yeah,
from something.
yeah, not part of the community, forgotten, unseen. Okay, separation from society, right? There's no emotional connection, right? This is pretty prevalent in the poor, people living in poverty, the homeless, right? Migrant workers. They're kind of invisible to society. Okay. And then poverty. This is really important. Okay. If you're asked a question of, and here's what in this first sentence, what is the key word?
Vulnerability.
That's the second keyword. What's the first?
Primary.
Primary. So if you were to get asked a question about, let's say you were to get, what is the primary cause of vulnerability in the US? What's the answer?
Poverty.
Poverty. Okay. We go through this, the whole term poverty affects everything. Poverty is your primary cause of vulnerability, because what does poverty cause? Okay, it's risks with food, shelter, school, cause problems with everything. Okay. And then it gives you this status of the poverty guideline. I'm not worried about you guys knowing that, but what I want you to take away from this bullet is that poverty is the primary cause of vulnerability. Okay. And then education. Higher levels of education lead to better choices, right? Leads to higher self-confidence, and thus the term resiliency. Okay, what's resiliency? Your ability to just move forward and get it done, right? What else affects vulnerability? Disabilities, right? Complex and physical or mental disabilities certainly increase vulnerability. I mean, most of our population, homeless population, are disabled. Okay. And then veterans and military. Why are they considered a vulnerable population? Right. And the rest of this
trauma, a lot of trauma, right? In that community, homelessness is prevalent.
Separation from family when deployed, reconnecting when you come back from deployment. Okay. Outcomes. So I'm just the yellow highlight is just the I'm just trying to highlight what the paragraph or what the bullet is about. Outcomes of vulnerability. Okay, without interventions, especially primary, you have a much lower health status, increased morbidity, mortality. And all this should be a review to you guys, right? We've covered this in class, okay? Higher prevalence of chronic illnesses, hypertension, communicable diseases, high mortality rates than the general population. Okay, maybe your living conditions, your diet, your health status. You know, if you live in a community with a lot of crime, violence, gangs. Okay. What are some interventions for the vulnerable? Okay, we talked about this week in class is empathy, compassion, respect. Trying to develop a trusting relationship initially so that you can help these people or help this family who's homeless or vulnerable, right? Everybody's worthy of respect and kindness, right? Make no assumptions. Let them tell your story. A lot of this information too, which is what it looks familiar because I've copy and pasted a lot of this from your notes. Okay. So, anyway, you can read through the interventions. Okay. Resources. Recognize roles that resiliency plays, right? The more out of control they feel, the worse decisions they're going to make. Right? Lack of resiliency, that's a big word for this exam. Lack of resiliency generally leads to individuals making decisions that will make things worse. And then what about caregivers? Caring for the caregivers of the vulnerable populations. Okay. They're kind of a forgotten group, but they're important. Right? What do we have to recognize about the caregivers who take care of these vulnerable populations, the chronically ill? They're at risk too. Okay. So that's week 1. Week 2, we talked about school nursing, right? What does the school nurse do? Triage, right? Make sure the kids are safe, but has to triage a lot. Okay. School nurses prioritize their ABCs all the time. Okay. We had a question on the quiz about which student do we want to see first? All those students need to be seen for one reason or another, but there was one student that was, coughing and couldn't participate in exercise. That was a priority. Okay, so that's part of the triaging. Okay, lots of times kids come to the clinic complaining of headaches and stomach aches. We talked about this in class. And I even gave this example. Let's say you have a student coming to the clinic every day with a stomach ache. And you finally determine after 2 or 3 days she doesn't have a stomach ache. What's your role as a nurse?
Didn't you need to find out why then that she's gone there and told you that? Because it could be something else.
Like,
Or it could be something psychological.
Anything like that.
what's prevalent in the schools? Bullying, harassment. You have to dig deeper. Okay. Are they struggling in a particular class they're trying to avoid? Is there any kind of sexual or physical or emotional abuse at home that's going on? I had a horrible case of a middle female student, middle school, a couple of years ago that this was happening. And it turns out that there was a lot of stuff going on. The coming to the clinic was just the cry for help. Right? But when we started evaluating what was going on, it was an absolute nightmare. The student ended up in foster care, actually. So you have to be mindful of, you know what a stomach ache is, and you know what a stomach ache is not. You have to be able to take that extra step and use your nursing process and try and help figure out what's going on. Okay. Obesity. School nurses deal with this all the time. Rates of obesity in children have been rising for many reasons. Okay. Obesity in kids also increases bullying, chronic stress. And again, I'm just going through this. Please take a look at everything else that's in here that's not highlighted. Right? Type 2 diabetes is on the rise. Okay. What groups are they higher? Type 2 diabetes is higher in ethnic minority groups, Hispanic, African American, American Indians. And you had a question about acanthosis, right? On your quiz, right? We need to know that. What are they? Dark patches of skin folds that don't itch or burn. Okay. If you're asked a question about that, what is it a potential sign of? Diabetes, right? Remember that question where the parents need to get a medical evaluation, right?
Specifically a sign of insulin resistance, right?
Well, initially it can be a sign of, if they haven't been diagnosed, it can be a sign of they have diabetes.
Okay.
And then injuries and accidents are very common causes of preventable injuries or accidents, okay, and death in children. What are some examples? Fires, falls, drownings, suffocation. Okay, and then we talk about the exposure to secondhand smoke. Certainly at risk for infants with SIDS, okay, especially when mom smokes during pregnancy. They also have increased rates of respiratory infections, right? So what do you do? What do you do when you're doing a home visit and it's a smoking house and there's young kids and some of them have asthma? Your end goal, what is your end goal? Get the parents to either stop smoking, provide them resources, maybe smoking cessation, education about the long-term effects of smoke on kids. Okay. So that's your job as the nurse doing your home visit, trying to help this house be smoke-free, maybe go outside and smoke. What if a parent says, oh, don't worry, I use e-cigarettes now. Is that cool?
No, they're just as bad as regular cigarettes.
Exactly. So if a parent says, hey, I smoke 2 packs a day instead of 3. Nope, it's not going to cut it. I smoke outside now. Okay, that's an improvement, but obviously the end goal is a smoke-free environment for these kids, right? And then educating parents about maintaining their child's health. What should we know? Here's a nice little paragraph about all the primary preventions we can do and educating parents about best way to maintain their child's health. When are checkups recommended? Right? When are immunizations recommended? Right? Parents should be able to recognize when kids are sick. Maybe recognize for iron deficiency. So please have a look at this paragraph. Okay?
I have a question.
Sure.
A home health nurse visiting a patient's home or visiting a child's home and teaching about smoke cessation. That's an example of community-based and not oriented, right?
Correct.
Since you're in that home. Okay.
Absolutely. Yep.
Okay. I'm trying to
Yep.
just conceptualize it a bit more in my head.
Yep. Whereas a nurse that's doing an assessment of the community has determined that there's a lot of obese people in the community. So she's going to try and develop a program, education program to educate that population on the long-term effects of, right? It's population focused
Mhm.
versus going into the home and taking care of this family. Yes, exactly.
Okay, okay.
One of the other things, and I've highlighted this, that we should be teaching the parents is that kids need to be active for 30 to 60 minutes a day. That's a recommendation from American Academy of Pediatrics. Okay, the next topic will be covered with health risks across the lifespan. Okay, can you identify what's a health risk for an infant? What's a health risk, the SIDS, health risks for kids. We talk about bike safety, helmet safety, adolescents, seatbelt safety, and so on. Okay, so you should be able to identify the most common risks for each of these groups. The elderly, falls. Okay. Here we talk about it's important if you're in the community, you may be working with teenage kids. I worked with teenage kids where we're kind of still in the school nurse area here. So domestic violence, you need to be aware that domestic violence can be begin very early in teen relationships. Right. So as school nurses, we need to be open to the consideration that any relationship can be violent. And the kids don't want to talk, right? So you have to be strategic. Let students tell you about their relationship. Ask open-ended questions. Give them the opportunity to share. Okay? You have to be able to ask those open-ended questions to these kids. And I know it says health risks across the lifespan. We're just addressing one group here, which is your dating, your teenage dating. But there are also health risks across the other populations as well. And that's in your reading. Okay. And the next paragraph is dietary, right? Dietary modifications, dietary education is an excellent tool in the prevention and management of many conditions. Okay. So read through that. Chronic illness management, which is tertiary prevention, is about improving self-care capacity, preventing complications, improving quality of life, reducing symptoms, right? That's just a review. And then I've just literally copy and pasted the childhood ailments section onto here. Okay, there's a question or two about, I think, every childhood ailment that we reviewed in class on the exam. So know your childhood ailments. Okay, we're not going to go through them. Does anybody need me to stop at any of them and go through them? We went over them in class. Asthma, eczema, diabetes, conjunctivitis, scabies, lice, ADHD, iron deficiency, anemia, scoliosis, lead exposure. Okay, so I think there's a question at least about every one of those. Okay. And back at the very beginning of this, where am I? Back at the very beginning of this, here's your summary. If you want to go, I mean, the questions on the exam about these, you're not going to find all the information in this study guide. You have to go back and have a look at your reading. Okay. And then this past week, we covered migrants, rural, homeless, poverty. So this is just a review of that. Right. We do know that there is a endemic level of depression in the rural community. Right. Why? Poverty. I just highlighted a lot of reasons. Poverty, economic difficulties, insufficient number of mental health care professionals, delays in seeking treatment, right? Destructive coping, smoking, drinking, drugs, violence. Okay. And then the characteristics of rural life. Okay, kind of a summary of what we talked about this week. Okay. And then rural areas, you need to know this. What are the four high-risk industries in the rural areas? We went through this in class: forestry, mining, marine-related
Farming.
fields. Pardon me?
Farming.
Farming? Well, yeah, agriculture. Yep, forestry, mining, marine-related fields, and agriculture. And why are these areas at risk? These fields, these industries at risk? Here's a nice summary right here. Okay, important to know this: farm workers, they have lots of health risks, but their primary health risk is the pesticide exposure. Okay. And then I even went as far as pesticide exposure, what's acute and what's chronic. That's how important that this risk is to knowing about in the farming community. Okay. Okay, so again, I copy and pasted a lot of this information about the week 3 from your notes. Okay. We talked about this in class. What might lead to homelessness? And this is important. The highest risk for homelessness would be in individuals facing multiple issues at the same time. Okay. Lacking family support, social support. Like the example is a veteran with PTSD. That's just one example. Okay. Then the last part of the study guide is a nice summary with lots of bullets under each, with primary, secondary, and tertiary, that addresses the whole study guide. What are some examples of primary, secondary? So teaching new parents how to model healthy eating habits and physical activity for their kids. Everybody understand why that's primary? Incorporating physical activity in the school setting. Advocating for the elimination of junk foods in schools. Providing developmentally appropriate sex education early. Right? Maybe to help prevent unintended pregnancies or STDs. Maybe providing, this is more your middle school, high school, but it really is getting down to elementary school, age-appropriate, adaptive coping mechanisms. How do you deal with bullying? How do you deal with substance abuse or peer pressure? Okay. And some examples of secondary: blood screening, blood pressure checks, BMI measurement. And then certainly screening for, you don't necessarily, you can screen for a mammogram, but you can also screen for financial instability. Who's at risk for poverty? Who's at risk for vulnerability? Right? Homelessness, complex disabilities, mental illness, right? So you can screen for all of that. TB skin tests, teaching signs and symptoms of illness to clients. So maybe teaching somebody how to do a self-breast exam, or teaching homeless residents to know what the signs and symptoms of TB are so they can report it. Again, you're trying to identify your at-risk population. And remember, questionnaires are also a form of screening. Surveys, questionnaires, however you're gathering your information, you're doing a screening. Okay, and then tertiary prevention. They already have something. So in every one of these bullets, they have something: diabetes, diabetes. They must have a condition that requires them to take medication. So one of your tertiary interventions is providing education on side effects. Hypertension, diabetes, obesity, homeless. Okay, so tertiary, they have something going on. Okay, and there's a couple of additional topics to cover that I wouldn't say I didn't cover, but I didn't pull out and cover well enough. So I thought I'd provide you some information. Motivation. Motivation is really important with these groups of vulnerable populations. A lot of times there's a lack of motivation. Okay, so this gives a nice summary of how you understand motivation. Okay. How do we motivate people to be engaged in their healthcare, engaged in their overall health? Okay. And then home safety. This is in one of your chapters. I think this is in, anyway, when you review your chapters, I think it's in chapter 12. Gun safety. Let's say you're going on a home visit. Okay, let's say it's an unannounced visit, right? For home visits, we have announced and unannounced. Your announced visits are great. You're set up, you're working with new families, new babies, teaching them how to care, bathe their baby and breastfeed and all that fun stuff. Okay, but what if you're on well, either visit, but what if you're on an unannounced visit ordered by the courts? And you're with a police officer. You're there to, people may not be happy with you. Okay, so we always have to assess for safety. So let's start with just safety first. Okay, we talked about this in class. Okay, how do you evaluate the community and make sure the environment you're going into is safe? Okay, so once we get to the visit, whether it's announced or unannounced, we always have to assess gun safety, right? Gun violence is very prevalent with regards to accidental injuries or death of people, especially kids. All right, so you have, when you go in to do your visit, your part of your assessment is safety. Sure, you're doing an environmental assessment, safety assessment, you're doing lots of assessments, but one of the assessments you're going to be doing right off the bat is your safety assessment. Right, so when you're evaluating your client's home for safety, the first question you ask is, do you guys have firearms? The question is no, okay. But if it's yes, right, you have to take it a step further. You have to find out where that firearm is stored, right? Make sure it's stored safely. I know there's a lot of discussion about this, I get it, but this is what we teach with regards to home health visits and visiting home. Firearms should be stored unlocked, unloaded, locked, and ammunition stored in a, you have to know that these guns are secured, right? Maybe asking who has access to the gun. What's the purpose of the gun? Okay, I know it's a hot topic. I get it. But that has to be part of your initial assessment. And that's why you have to be able to apply your ADPI in different settings. So your assessment with this looks a whole lot different than an assessment of a patient in the hospital, right? Another section, educating, this is in your reading as well, educating parents on minimizing the spread of infections at home. What are some points we could go over with them? Wash your hand, pardon me?
Yeah, that's what I was saying, hand washing.
Yep, wash your hands, when, before eating, before, during, after, preparing foods, right? So you can read through that, but that's part of, community nursing is a lot of education. Okay. Even in your community-based nursing is a lot of education. Yes, you're doing illness care, but you're also doing a lot of education. Okay. And then the last part is understanding social determinants of health. What that means is, how do we determine the health of an individual, a family, a subset of a population in the community? How do we determine the health of those clients based on social factors? Okay, so what do we consider social factors? Okay, so this is basically saying understanding what determines the health based on social factors. That's what determinants means. Determine. Okay, what are social what are we looking at? Housing, transportation, discrimination, violence, education, job opportunities. These are all social determinants. Access to nutritious foods. Is there polluted air and water? Education, language, and literacy. Those are all, if those are all compromised, pardon me, if those are all compromised, what state of health are you going to probably see? Probably very vulnerable, right? If your social determinants are high crime, violence, poor housing, high unemployment, okay, you're probably going to find that a lot of your population is in poor health. Make sense? Whereas if your social determinants are I wouldn't say good, but if you're able to have shelter, able to have a car, don't live in a community that has high violence, educated community, right? Your health is probably going to be, the health of your situation is probably going to be much stronger, right? So anyway.
Does that count as resiliency
Yeah,
then?
absolutely. What are you doing to make your social determinants better? To limit your risk or minimize your risk or improve your chances of success. Yeah, that's exactly what resiliency is. Yeah. So that's a study guide. Is that helpful to go through it like that? Teresa? Hannah?
Yeah.
Okay. Anybody have any questions? Again, don't just rely on the highlighted parts of the study guide. That was just highlighting topics. Okay. And again, you don't have 3 pockets of information. You don't, your reading is not separate from your notes, which is not separate from your study guide. They're all connected. Right? So the notes are compiled from your readings. Right? And they're compiled from your readings. Then the study guide is a compilation of your readings and your notes and lecture. So this information should all be familiar to you. You just need to dig into some of the topics a little bit deeper from your readings. And if you've been in class the last 3 weeks, a lot of this probably sounds repetitive. But this is a review, so we're reviewing the last 3 weeks. Okay. Questions? Helpful? Did you guys all put your names in the chat?
Yes, I did.
Okay. All right, the exams are, I think all you guys are my students. Teresa. Where is Damon? Is that how you pronounce your name?
It's Diamond.
Diamond. I know you and I have been communicating this week. Was this helpful?
A little.
A little.
Yes,
Okay.
ma'am.
All right. So you know what you need to do, right?
Yes, ma'am.
Okay. So again, review everything we've just done. If there's topics that you don't understand, you need to get back with me and we'll schedule some time to meet. And that goes for everybody.
Okay, thank you.
All right. Well, I hope you guys have a good weekend. And thanks for coming. Thanks for coming. I'll send out the recording to this if you want to review it once it converts over. Okay?
I have a good weekend. Bye-bye.
Okay.
Thank
You're
Thank you.
welcome. You're very welcome.